Okay, good afternoon, everyone. I'm Dr. Strong from Jordan Valley. So we've got some people online watching, so welcome everybody. We've got 3 students and a resident here. Dr. Bell, are you first year this year still?
No, second.
Second year, okay, I couldn't remember.
About to be third year.
That's crazy.
Yeah.
So who are the current first years with us at Jordan Valley?
That is Irwin and Newland for the current first.
Okay.
years.
Irwin and Newland. All right. And are you a Cox resident at Jordan Valley?
Mhm.
Okay, so a little different because Irwin and Newland are Jordan Valley
Yeah.
residents. Okay. A subtle difference, but it's a little different. Okay, tell me y'all's names again, please.
Taylor.
Josh.
Taylor, Josh,
Molly.
and Molly. Okay, I haven't met you before, have I?
We did newborn care for a couple
A
days.
couple days.
Yeah.
Okay, well, nice to see you again.
Nice to see you.
So, for those of all of you online, let's see, we got people from all over the place. Is that right? All over
Missouri.
all over Missouri? Okay, I saw Stanley on there for a minute. Now Stanley's gone. He probably saw it was me speaking.
Yeah.
He's like, I'm out. Oh, welcome back, Stanley. Okay, well, today basically I'm going to talk a little bit about the integrated model of care, which is what we do at Jordan Valley, and I feel like that we do it pretty well there. Dr. Bell might be able to chime in and speak to that a little bit too. But when I say integrated model of care, what does that mean to you all? And anybody can feel free to chime in here and tell me what you think of when you hear integrated care. So what do you think of when you hear integrated care? Not many thoughts?
Crickets.
Anyone? Anybody online want to chime in? Do you hear integrated care model? What does that make you think of?
Makes me think of, I would say, incorporating, all aspects of the patient when it comes to care.
Very good. So kind of similar to holistic, or are you talking like different service lines?
I would say both, but more so service lines.
Yeah, okay. So that's kind of what we're talking about at Jordan Valley when we talk about an integrated model of care, is trying to meet as many different needs for the patient that we can while they're in the clinic. The population that we serve, of course, tends to be the underserved community of Springfield. That's our target audience, our target clients and patients. So being that they are already underserved, they have some difficulty and challenges a lot of times getting the care they need, whether it be getting to the office to get to their appointment, or whether it be transportation, whether it be getting back to more appointments because they have to work, and they have difficulty getting off work. It can be any number of barriers. They don't have a phone that works, so it's hard to get in touch with them to get them back into the office. It's hard to confirm their appointments. Maybe they just don't have really good life skills, so they don't keep up with their Medicaid application, and their Medicaid expires, and then they show up at the office and they don't have any insurance and they don't have any way to pay for their visit. So what we do at Jordan Valley is we try to meet them where they're at, and we try to integrate as many different service lines into their care as we can. So I work on the pediatric team at Jordan Valley. Most of the time, I'll pop up in different places, regional clinics, Hollister, Republic, maybe even Marshfield or Lebanon at times. And I also cover occasionally in our express care clinic, which is kind of like our urgent care, a little bit less or lower acuity, I guess, compared to the typical urgent care. For instance, we do have x-ray, we do have some labs, but we don't typically run IVs or do that sort of thing in our urgent care. But, so how do we integrate different service lines into the care of our patients? So the different service lines we have available at Jordan Valley, of course, we have medical. We've got lots of medical providers. We have residents. We've got physicians. We've got mid-level providers. We have dental. Dental is huge in Jordan Valley. A big determinant of health for people is also their oral health. So we try to help them with their oral health when they come see us to keep them healthier, keep them better, able to eat better. Because if they're able to eat better, they're going to be healthier. We try to do lots of education in that regard. So we have medical, we have dental. Of course, with our population, we have a lot of behavioral health issues, mental, emotional, behavioral health stuff. So we have a whole behavioral health team. We have behavioral health consultants, and I'll kind of talk about how we integrate them into our visits. So we have medical, dental, behavioral. We also have some physical therapy, some occupational therapy, some speech therapy. We also have optometry, which is helping people see better, of course, which is really helpful with patients that come into the clinic and they may have an eye complaint that we're not really sure about, we're not maybe super comfortable with. And so we have optometrists that would typically get them worked in same day, or we can take care of the problem initially and then have them follow up the optometrist in the next day, maybe 24 hours, to make sure things are going like we expected and we didn't miss anything significant with the eyes. Because you don't want to miss anything with the eyes or really any other system, but especially not the eyes. We also have substance use treatments, which is same day availability and walk-in. So we try to integrate that into our care model as well. If we have patients that have difficulty with substance use, we can get them in to see one of our substance use treatment. I forget what we call that now. Is that what it's called?
No.
Substance use treatment?
Over like a bit.
Yes.
Yeah.
So we have a whole team that can get those patients in, get them on some Subutex or Suboxone right away as indicated. We can work with them on tapering down their benzos if they need help with that. We also have rehabilitation type counselors, drug rehab type counselors that can help people get off of other addictions. We work with people, of course, getting off of cannabis and off of nicotine as well. That's pretty standard. PCPs also do that on a regular basis. And I'm trying to think of the other service line. Oh, we have pain management as well. So we also integrate pain management into our service lines. So we have a whole pain management team that helps out all of our primary care providers for these patients that come in looking for pain management. But it's really challenging to take care of diabetes and blood pressure and heart failure and do good pain management all in one visit. So as studies have bared out over the years, getting them into a specialized pain management program is really helpful. And in pain management, we have an integrated approach. So we have the medication side of that, we have the behavioral health side of that, and they're also required to attend group sessions to talk about how to deal with their pain and how to improve their pain management without medications, which is helpful for a lot of folks. So what does that look like when we're in the office seeing patients? It's really nice at Jordan Valley for me because if I have a teenager that comes in, they are having either behavior problems at school or with their family. Maybe they're having a challenging situation with a stepdad or a stepmom. Maybe they've got trouble with getting bullied at school and they're having trouble with depression. I can talk with them about those things, evaluate it, assess whether or not they're in any kind of danger to themselves or anyone else. And then I can grab my behavioral health consultant down the hall and say, hey, Amanda, I've got this 15-year-old young man in here who seems pretty depressed. He's having trouble sleeping and he's having trouble at school, getting in trouble a lot. Could you come talk with him? So my behavioral health consultant will give him a warm handoff. I'll introduce my behavioral health consultant to the patient and the family, introduce them. They go in and talk with them for a little bit. And then we might meet back up in the hallway or in our provider pod and formulate a treatment plan together that involves both some follow-up therapy sessions and maybe also starting a little medication. So that's kind of just a brief scenario of the integrated model of care. works really well for our patients. It gets them introduced to the therapist. They're much more likely to follow up with somebody that they have met, and rather than just walking in blind to talk with somebody about their feelings. So I think that's really helpful. The same is true with dental visits. We have kids that come in on both sides. They might come in for a dental checkup because their parents decided they need to get their teeth checked. And the dentist looks at their shot record and sees, oh, there's a lot of care gaps here that we need to get some vaccines done on. So they will get them scheduled with us at on the medical side, or we'll just move them over when they're finished with their dental checkup, do a well child visit and get them their vaccines. The same is true the other direction. We'll see him as for a well child visit. Oh, I see that you haven't seen a dentist here for 3 years. Would you like to see a dentist today? And so a lot of times we can get them into our same day work-in slots on our dental team, which is really helpful at getting kids seen while they're there. They don't have to miss more school. Parents don't have to take off 4 days of work, and it eliminates the communication difficulties that are inherent with trying to get people scheduled for multiple appointments and get them back in the office often. So you kind of do the same thing on the adult side, I would imagine.
Yeah.
I know when I'm in express care, I'll see people if they've got a behavioral health crisis and depression, they're kind of having a crisis, they're feeling super depressed, they're thinking about hurting themselves or something like that. We can get a behavioral health consultant in to talk with them, get them plugged into some therapy, and then get them follow up with our family practice team. So really, the basis of the integrated model of care is having a group of people from different disciplines that are willing to work together to meet the needs of the patient. And that's really key. So, you know, a lot of you who are in med school probably started med school because you wanted to help people, right? So a lot of times as you get further along in medicine, it becomes maybe less about helping people and a little bit more about, you know, how do I make sure my collections are exceeding my expenses so I can make good money? And so one of the benefits, I think, of working for an FQHC is I don't have to worry too much about that side of things as much as I am concerned about taking care of patients and getting them into the people that they need to see. And when you have a group of different disciplines that work together to do that, it makes taking care of patients a lot of fun and very rewarding. Even though we take care of some pretty needy, complicated, difficult patients sometimes, we have a great team that carries it out together. So everybody bears a little bit of the load and nobody has to carry the full weight. So physical therapy, occupational therapy, speech therapy, those are service lines we have on the pediatric team. I think we have physical therapy for adults too, at times.
Sometimes, yeah.
Sometimes we have some, I don't even call it an agreement with Missouri State, the physical therapy department. And so they will have some of their students come over to do some therapy for our patients, either at a discounted rate or at no charge, to get them some extra experience, which is super helpful. Just demonstrating some exercises for them, teaching them how to do them so that they can get some good progress with their conditions. That's another way we integrate. Of course, just like with dental and medical, we'll do the same thing with optometry. Somebody comes in, we ask them in the review systems, how's your vision? Do you have any trouble with your vision? They might say, oh, you know, I really have a hard time seeing at night or a hard time seeing when I'm driving. I can't read the signs. Then we can get them set up with our optometry team, get them in, get them some glasses pretty quick. Part of all of that revolves around getting them approved for benefits, which goes to our pre-check-in team, our patient engagement team. So we also have a patient engagement team that is really good at getting people started with their Medicaid applications and getting those done. We can get them presumptive approval for Medicaid and get them a lot of services even that same day. And then, of course, if their Medicaid application goes through, they get approved. Then we can get them in later for multiple different service lines to get the work done that they need. Does that sound like a decent explanation to you, Dr. Bell?
Yeah.
Okay. So we got lots of time. So I'll tell you a little, I didn't give myself an intro. So I'm Dr. Strong. I've been at Jordan Valley for 13 years now. I came over from private practice at Cox 13 years ago. And they were needing some help at Jordan Valley, and I was looking to make a change in my practice. And Jordan Valley has been a great fit for me. Kind of like I said, I'm able to see patients, take care of them, and really work on helping people out rather than worrying as much about my payer mix or some of the other nuances of the administrative side of medicine. Although you still have to think about those things anytime you're in practice, anywhere. You'll always deal with administration, you'll always deal with billing. You got to make sure you are documenting appropriately, that you're billing appropriately. But like I said, in Jordan Valley, it's been really nice to be able to help people and not worry quite as much about the numbers game as you do in private practice. So that's really nice. And of course, working with a lot of other providers who are like-minded to the same mission of helping people out, meeting people where they are, and trying to work to improve their life in the integrated sense, in the holistic sense, is also really fun. So it's a good place to be.
So I have a question.
Yes.
So since you have worked at Jordan Valley and with Cox, but you were like, were you at like just a clinic?
Yes, so when I first finished residency, I went into outpatient practice. I was in a clinic, seeing outpatient patients, outpatient clinic, working outpatient clinic, seeing only outpatient visits. I did not do any hospital then. We did a lot of procedures in our clinic. So that was one thing that drew me to family medicine, was just the procedural side of medicine, doing lots of, I did lots of skin procedures. I do vasectomies, which I still do. Of course, we do a lot of circumcisions on the pediatric side, doing newborn rounds. We see lots of babies and we do lots of circumcisions. But yes, so when I was at Cox, I did outpatient clinic 4.5 days a week. And that's pretty much it.
So since Jordan Valley has this integrative care model, the focus is pretty strong on interprofessional experiences, right? Within the providers themselves and everybody working together.
Right.
In your opinion / experience, how much better or worse, but probably better, is it within Jordan Valley than it is at a private?
How much better is the integrated model of care?
That the like the interprofessional, just everybody,
Yeah,
the
working
IP
together.
component of it, working together. Because I'm only talking about that because we're getting ready to talk about it a little bit. So just to get
Yeah.
our minds thinking about it a little bit.
Sure.
More. But
Yeah, well, yeah, being on both sides of it, the collaboration between providers, I think at Jordan Valley is really great. Almost all the time. Occasionally I have little hiccups, but most of the time things work pretty smoothly. Especially with the medical and dental integration, the medical and optometry integration is really great. On the ped side, working with our therapist is great. If we have a baby who's not meeting developmental milestones, I will grab one of our OTs and introduce them to the patient. They'll do a brief session then, and then get them enrolled in further sessions. So, at the clinic I was with Cox, we actually had physical therapy in-house, which was super nice for a family practice group. We had about 5 or 6 family practice providers. We had 2 physical therapists. We did not have behavioral health there. In residency, we had behavioral health, which was very nice. That was kind of probably an early integrated model that we did at Cox with the residency. Even back in the early 2000s, people, before some of you may have been born, we had behavioral health consultants in the clinic with us, which was really helpful, especially for, I know those patients come in, they're in crisis, and you look at them and you're thinking, I'm not a therapist, I don't know what to do with this, especially when you're 20, 24, 26. How old are you guys when you get out of med school? Yeah, 26 years old. So when you're young, you got limited life experience, and these people come in and they've got, crises going on. And you're like, man, I don't know what to tell you about this. And it's really helpful to be able to grab somebody with some more counseling experience and say, hey, come in here and let's talk with this person. And it's also very helpful to be able to sit in with them and talk all together. You're talking about that interprofessional interactions. That's really helpful because you can glean a lot of wisdom and a lot of experience, a lot of good tips from those other providers when you see how they interact with patients, the questions they ask, the things they say, and it can really help you with your own like brief therapy model. It can help you, know the things to ask and make sure you key in on when you're dealing with certain situations. So I would say overall, it's much better, much more helpful. The interprofessional interactions are much nicer overall. You don't have, I haven't really experienced any turf type issues. People feel like, oh, well, this is my realm, you're in my space. You need to move on and I'll take care of this. I don't experience any of that at Jordan Valley. So yeah, it's a very enjoyable place to work.
So another thing I was thinking, so you have, remind me, is all of dental in the Tampa location?
No, we have dental at every regional location.
Oh, okay.
We have dental at the Grand location. Most of our adult dental is at Tampa because that's where most of our adult medicine is. But we do have a dental team to address the needs of our pregnant ladies because we have the women's and children's clinic. So we have a women's health kind of dental team, which is basically adult dental, but they know they're taking care of pregnant ladies a lot. We also have pediatric dental right there with the pediatric team, the pediatric medical team. So they're right there in the front hall and we're in the next couple halls. So we work very closely with pediatric dental. I imagine family medicine. I know family medicine has the front part of the building. Dental is in the back hall at Tampa location. And also there's a lot of dental places, a lot of dental rooms downstairs where they do, lots of dental, but we do the integrated kind of model upstairs. So we have dental at every location where there is medical, and we also have dental at the Kingsley location, which is kind of our special needs dental patient suite, where they have some various other things that we can do there to help accommodate kids and adults with special needs that are especially scared of the dentist or have a little more difficulty, getting their dental work done. Of course, our dentists also do a lot of exams and fillings and extractions under anesthesia. So at the Grand building, we have our dental operating suites. The dentists also have privileges at Mercy and Cox, so they will take patients to the operating room at both places there as well. So lots going on, lots of moving parts, trying to get people taken care of as much as possible. Yeah, you guys have any other questions about integrated care? Anybody online got questions about what we do, how we do it?
I'm curious, just like if you know how widespread like the integrated model is Jordan Valley like unique, or are they like popping up on the rise, etc.?
I would say Jordan Valley is very unique in how many different service lines and how integrated we are. We definitely talk with a lot of other FQHCs as well as other clinics about that. And I think a lot of people come and look at our clinic to see how they can better implement the integrated model. But we're also always looking to do things better and make changes that will help, get our patients taken care of, get their needs met while they're there, when they're there. So it's kind of like the weather in the Ozarks at Jordan Valley. If you stick around for a little while, things are probably going to change. There's been lots of changes since I've been there. We're always looking at what other service line can we add or do we need to add? One that we recently added is rheumatology. So We don't have a rheumatologist in-house per se, but we do have a new relationship with a rheumatologist that will do telehealth visits with our patients. And so we can get them in with rheumatology because, rheumatology is a really tough referral to get into. Within a year, probably in person, here locally. Just because there's a lot of folks with rheumatologic conditions and difficulties, and there's not a lot of rheumatologists in Springfield. But we have established a relationship with a telehealth rheumatologist, so now we can get our patients in a timely manner with rheumatology. And keep it basically within Jordan Valley, so we don't have to refer out to get those services taken care of. I didn't mention our PACE program. We have a program for all-inclusive care of the elderly as well. We call it Jordan Valley Senior Care. So what we do with that is basically nursing home level of care, but we keep people in their homes. So we have a day center where they can come, get physical therapy, get speech therapy, have medical visits, see the optometrist, see the dentist. All those things. We have case managers. We have people that go out to their homes and make sure their homes are a safe environment. If they need handrails, they will put up handrails for them. If they need a ramp, they will build them a ramp. So when we say, all-inclusive care of the elderly, that's what the goal of that program is. So that's a really cool program. They're always, that's a very young program at Jordan Valley, so they're working out the kinks on that all the time. And working to get that running more smoothly, more effective. And but it's been a really big benefit to a lot of our patients. And so when you have these folks that come in, maybe they're in your clinic every month. Maybe they have difficulty getting around. They've got a cane, they've got a wheelchair, they're over 55. If they would qualify for nursing home level care, they qualify for Jordan Valley Senior Care. So we try to get those folks enrolled in that program if they are interested and they're willing. It is what we call a capitated HMO plan. So basically, it works best if you are on Medicare and Medicaid. And if that's the case, Medicare and Medicaid gives Jordan Valley a chunk of money to manage those patients per month. And then we take care of all their needs and make sure we try to keep them out of the hospital, keep them out of the ER, keep them healthy, and improve their quality of life. Yeah.
So speaking of Medicare and Medicaid, can you talk a little bit more about Jordan Valley's patient population as far as socioeconomic status goes and their insurance and the sliding scale and that kind of thing?
Yep. So our goal at Jordan Valley is to take care of the underserved medical community of the Springfield area. Also Lebanon, Marshfield, Branson, Hollister. So most of our patients are Medicare, Medicaid patients or self-pay. That's kind of our target group. We do belong to the Cox Health Network. We belong to the Mercy Health Network. So we basically can take any type of commercial insurance. I think there's one exception, one plan at Mercy that is exclusive, that only Mercy can see those patients. It may be an Aetna plan, if I remember right. But most of our patients are Medicaid, Medicare, and self-pay. I'm not sure what the mix is on the adult side, family medicine, but I know on the pediatric side, we're about 85% Medicaid. Of course, most pediatric patients don't have Medicare. There's a few, I guess, probably to get on Medicare, you have to be over 18 and disabled. Because if you're under 18 disabled, you're on Medicaid only. That's all you would need. I'm not positive about that. But that's our main target clientele, like I said earlier. And that's our main parents, our main patient population. We do have a sliding scale for patients who don't qualify for Medicaid, but they also don't have insurance. And we basically give a discount based on their income and where it falls in terms of the current poverty line income requirements, which I don't even know what that is right now. I think it changes every year. But it's pretty significant. As like a family of four, you can make a fairly good amount of money per year and still qualify in the poverty line or below the poverty line. So I don't know if it's around 45 or 60,000. I'm thinking it's more around 60,000 a year. So if you've got a couple of, full-time, two income family, and they're both making 30,000 a year, which sounds, decent. It sounds really decent for like when I was in college. It's a long time ago, but that doesn't go nearly as far nowadays. So we do have the sliding scale for those folks. There's a lot of labs and services that are included with an office visit on sliding scale. But then the other services like other procedures and labs, you have to pay extra for. We also, I should have mentioned, we integrated our pharmacy into Jordan Valley in the past 5 years. We had a good relationship with the Walgreens pharmacy in Jordan Valley for many years now. But we found that having our own pharmacy allows us to do even more with discounts and government subsidies and getting medications to our patients at a lower cost to them, especially if they don't qualify for Medicaid or Medicare and they're self-pay. We can get really good discounts on medications to bring the cost way down so they can get the medicines they need and still be able to buy groceries and pay their phone bill. So lots of good opportunities.
So Jordan Valley also gets a lot of grants, right? As well, right?
Yes, I would say we get some grants. Having recently been privy to some of our financials a little more, the majority of our operating costs come from our collections from Medicaid and Medicare. So, it's just like any other practice. You do labs, you do office visits, you do procedures, you send the bill to insurance and insurance pays. The benefit of being a federally qualified health center, or FQHC, is Medicaid and Medicare pay us a little better than they do private practice folks. So we're able to collect a little bit more on that in that regard, which helps keep our operations going. Most of our grants are for special things, such as maybe a new building. We do get some capital improvement grants. Also, other special services like, a good example would be hepatitis C testing. We have a grant right now and for HIV testing. So we have grants for same-day hepatitis C and same-day HIV testing. So when patients come in, we try to screen them and ask them questions to see if they might be at risk of HIV or risk of hepatitis C. And we try to get them tested. The HIV test, I think, is about a 30, 45-minute test. Does that sound right?
Yeah.
And the hep C test is like a 15, 20-minute test. So we have patients come into the Express Care Clinic every day that have concerns about sexually transmitted illness. And we'll go ahead and test them for hepatitis C and HIV and either make sure they're negative, or if we find out there's a positive, then we can get them plugged into one of our providers who treats for hepatitis C, which, as you all know, doing your medical school know, now we've got really great hepatitis C treatment regimens, which are oral pills and are really effective in eradicating hepatitis C. Much better than it was 15, 20 years ago, when you had to take like interferon shots and feel sick for like 3 months straight, or maybe 6 or 9 months. So we got great treatment options, and because we have our own pharmacy, we're able to get that treatment to these patients, even if they can't afford it otherwise, or wouldn't be able to afford it otherwise. So those are some of the ways that we, utilize those grants.
It's like more community, a lot of community
Yes,
focus too.
community health, population health. We have a pharmacy. We don't only do have our pharmacy, we have our PharmD team as well. Where we have our doctors of pharmacy who work with our providers. They give us advice on changing medications as needed. Improving medication control for diabetics, high blood pressure. Any other examples you think of? Heart failure.
And it's really great having them, especially for people with diabetes, where if my schedule's built out for 3 months and I have no availability and we're needing to titrate insulin.
Right.
We're able to get in to see the pharmacist kind of in between seeing me, and then we're able to kind of communicate back and forth as kind of a team there.
Right.
To keep adjusting that patient's insulin.
Yeah, that's a great example. And I have the same experience. I don't have nearly as many adult patients as I used to. When I was in private practice, I was probably 85% adults and 15% kids. And now I'm probably flip-flopped. So I probably have 85% kids and 15% adults. But the adults I do have, most of your adults, not most, but a lot of your adults are gonna have the terrible triad, right? Diabetes, high blood pressure, and smoking. Oh, high cholesterol, sorry. Now they might smoke too, which is not gonna help anything, but they got the terrible trio, I call it, of diabetes, high blood pressure, and high cholesterol. And having those PharmDs on staff, we can, just send a secure chat through Epic, which is basically like a little text, a secure text attached to their chart. Our PharmDs will get them in, do a consultation with them, talk to them about the importance of their medication. Another way that we integrate in the same kind of way is with our nurse care managers. I don't know if you have much interaction with your nurse care managers over there,
Something.
but I have quite a bit because we have lots of kids with asthma. We have lots of kids with pediatric obesity problems. So that's a big issue right now. And our nurse care managers also are on partly, I think, paid by grants through a community health sort of a grant. And so we're able to utilize them to do spirometry testing every time we have an asthmatic kid come in. We check their FEV1, see how good they're doing with their asthma control. And the nurse care manager can do the asthma training. They can do the spirometry. They can make sure they're using their inhalers correctly with the spacer. And that takes a little bit more off of the provider's plate so we can keep seeing people and not get tied up for an hour training somebody on how to use their inhalers. PharmDs is the same way. They can teach them how to use their insulin injections. They can teach them how to use their GLP-1 injections. Talk to them about the importance of not only using that, but also modifying their diet to avoid side effects and problems. So they're super helpful. So our collaboration, I mean, it's on multiple levels and lots of different directions, but it's really fun to see it working in action and see it how it helps patients with their medical issues, helps them get better, helps them make lifestyle changes, and hopefully makes a big difference in their overall health and their lives. That's our goal. Anybody out there on the Zoom have any questions for me? You guys are all over the place, different parts of the state. I know St. Louis has got FQHC, Kansas City's got a couple, I believe.
Isn't there one in the Nevada region too, like Access?
I
or
don't
something?
know. Is that an FQHC
I don't know.
in Nevada? I know I've got some colleagues in Nevada from residency who are still doing family medicine OB there. So it's a good group out there. Dr. Conley, Dr. Russell, and we had a resident from Cox go there recently, I think, joined. Do you know who that was?
Yeah, Colby Smith.
Colby Smith. Yeah, Dr. Smith went back up there. I think he was from the area. So he went back home to make a difference in his hometown. We love seeing that. I think another thing that's nice, not just about the integrated model of care, but about being an FQHC, Jordan Valley. We've got great facilities. It's an FQHC, but it's not out in the middle of nowhere. And it's not in the inner city St. Louis. So if you wanted to work in an FQHC and get some loan repayment, for instance, it's a great place to be able to do that because Springfield's a nice town to live in. Jordan Valley is a great place to work, great colleagues, great team. And sometimes the days are tough and the days are long, but you're going to find that anywhere doing medicine. And you can go home definitely feeling fulfilled and a sense of accomplishment, and also get your loans paid off, which is a huge bonus. course, we do have the residency tract at Jordan Valley now, that works all in close conjunction with the Cox residency. So we have 3 spots per year now.
This year's 3,
This year's
next year's
3?
going to 4.
Next year's going to 4. Okay. So they're working on growing the residency at Jordan Valley. Of course, Cox also has multiple slots each year. Are they at 8 right now?
10.
10, so they increased as well. Wow, so really, everything seems like it's really growing crazy. And they also have the Branson tract. Is that new this year?
They just matched their first class.
Okay, and how many are in the class at Branson? There's 4?
I think it's 4, it's 3 or 4.
I think it's 12.
4, okay, so you guys know more about that than I do. But I think that's super cool too. Just more opportunities for residents, for people from the area to come back to the area, do their training here, kind of get to know some people. It was really nice after doing residency at Cox to work at Cox because I knew the specialist at Cox that I had gotten to know during residency. I still work with a lot of those same folks in taking care of patients together. And both Mercy and Cox have been great and supportive for Jordan Valley. Whenever we have people that we need to get in with a specialist, whether it be ENT or cardiology, pulmonology, various things. Dermatology is tough because they're so busy and backed up all the time. Rheumatology is pretty tough, but that drove the need, or that need kind of drove us to explore options for that, which opened up the opportunity for the telehealth visits with rheumatology. But both Mercy and Cox have been super helpful, super accommodating for our patients, because we know that they can be pretty challenging a lot of times. A lot of the patients that come to Jordan Valley are, maybe they've been kicked out of a couple other offices, or they've been non-compliant, so they didn't show up at their appointments, so they get "you got to find a new doctor" letter, which is really common in private practice. So, but we do our best to knock down barriers so they can get in and get taken care of.
So kind of switching gears a little bit, you take a lot of students
Yes.
for rotations. So can you kind of explain how, so you said Molly did you rotated it?
Some newborns at Cox. Yeah, because you
Oh,
did a
okay.
Cox rotation, family medicine.
So just for not only them, but for like the people online too, can
Yeah.
you just kind of explain what a student will see when they're on rotation? Like how much, like how hands-on is it at Jordan Valley?
Yeah.
Like how are the students integrated into everything?
Sure. So I would say it's probably pretty close to the same on family medicine as it is on the pediatric team. Depending on what attending you're with, several of us do newborn rounds. So if you're with us for a month, you're probably going to do a week of newborn rounds with us. And that's a half day in the morning of going to Mercy and Cox and seeing newborns. At Cox, we work with the residency now. So the residents will pre-round on the patients. Then we come in, we talk about the patients, and then we go around and see them together, or maybe just see them with the attending and the student, and do any examinations that we need to do, follow up on testing, make sure everybody's doing well. On a regular clinic day for me, we start in the morning. We see lots of well child visits. If we happen to be covering the pediatric express care, which we have at the Grand Building also, we'll see lots of sick kids. And how hands-on is it for students? I pretty much get them plugged in and seeing patients on their own right away. Maybe, after a half day of hanging out with me, or maybe a full day of hanging out with me, depending on what stage they are in school. If they're a brand new first rotation, third year, they might spend a day or two with me, getting the swing of things, getting the feel of things. But we get them a login to the computer system. We get them a login into Epic. We, get them all of the templates for our well child visits, and we have them go in, see patients, talk to people, talk to parents, do examinations. I'll usually have them watch me do a circumcision or two, and then if they're interested in trying one, we'll have them do some circumcisions. Sometimes we have a lot, sometimes we have a few. this week on newborn rounds, which is what I've been doing this week as well. I think we've only had a couple in the hospital. So not many surgs this week. We've had a lot of girls, not many boys. It kind of, it's kind of up and down. Yeah, it just kind of depends. I think, I also do vasectomies, like I said, I do other procedures. So if I have somebody who's interested in doing a knee injection or shoulder injection, then I'll talk them through that. Have them do things. I think I'm a learn by doing kind of person. So when I was in school, I wanted to be doing things and experiencing it because I learned a lot more and really, I think you cement it into your memory a lot better. Other people like to watch and learn a little before they try something new or different, and that's fine too. So we try to be accommodating to different learning styles and work with folks and bring them along and let them do as much as they want to do.
So we know you take medical students, but
Yes.
what other types of students do you have?
So on our team, we have two pediatricians at my office, myself, and we have 3 or 4 mid-levels. We have a couple of pediatric nurse practitioners, we have a physician assistant, we have a family nurse practitioner, and we have another physician assistant. And so my PAs take PA students, my NPs take NP students. I take medical students. We also have residents that rotate with us. And just to get a little more pediatric experience, more well-child experience. So sometimes I'll have a student and a resident, and I will kind of pop back and forth between them. We usually have plenty of patients for everyone to stay busy. So I'll have the resident see a patient, and then another patient will be roomed. I'll have the student see that one. We'll wrap up the resident's patient, put them in with the next patient, we'll wrap up the student's patient. So it's kind of a juggling game sometimes, but we get through it and we get lots of kids seen and hopefully have a little bit of fun along the way and do some learning. So.
And there's probably like dental students and.
We do have dental students. They're always with the dentists. We have had pediatric dental residents before at Jordan Valley. We had a pediatric dental residency for several years. And so we would have the pediatric dental residents that also did a medical rotation with pediatrics, because it's important for them to learn a little bit of the medical side of the kids they're taking care of. How to do vitals, what a sick kid looks like, what a well child looks like, things to watch out for, being able to listen to heart and lungs and make sure your kid is okay before you put them under anesthesia for a procedure. So
Probably important.
Yeah. So they're talking about getting that pediatric dental residency started back up. So that may be something we have in the future as well. Like I said, things are always changing at Jordan Valley. So there's been talk of a pediatric residency at Jordan Valley in the past. I don't know if that is still in the works or not. I think there were a lot of challenges for that one.
Mhm.
Just with the inpatient pediatric population in Springfield, there's not a lot of inpatient pediatrics that goes on in Springfield beyond your routine kids. For the most part, we have a PICU at Cox. I'm sure we have a PICU at Mercy. But yeah, we take lots of students. I get students from MU, ATSU, KCU. Occasionally, it seems like I've had students come through from Arkansas.
Say probably Arkansas. I know there's some in the area.
Yeah, there used to be more students, I think, that came up from Arkansas, from Northwest Arkansas AHEC. That would come up and rotate with us a little bit. Yeah, I get lots of requests for PA and nurse practitioner students, but I usually tell them, hey, we're really busy with our medical students and such, so if you can get them in with the other folks on our team, that's more beneficial. But I used to take a lot of PA students
I thought you
before we had
Yeah.
med students. Not as much anymore. They usually keep us pretty busy with the med students these days and the residents, which is great. That's great fun. Yeah. My time's about up. Anybody else got any questions? What are you guys planning to do? Your third years, right? Wrapping up third year. Yeah, have you figured out what you want to do with your life yet?
Family med probably.
Family medicine?
Oh my god,
OB-GYN, okay.
Emergency med.
Emergency medicine. I think you were You talked about that before, weren't you? This kind of been your thing for a while. Very good. Well, cool. Yeah, good variety. And I'm sure online we got lots of different different specialties represented here or different goals.
Oh, I'm sure.
I don't know that I bet anybody else except for Stanley. Anybody else have any comments or questions before we move on to some cases with Dr. Bell? You guys are kind of a shy bunch.
They always are.
Yeah. Okay, that's all right.
Okay, well, thank
Okay.
you.
Yeah, thanks, guys. Good to
Thank
see-
you.
Yeah, thank you. Thanks for being here. See you, man.
You too?
Yeah.